Hi guys, my name's Dom, the assistant sports therapist at the Bristol Flyers. We're going to be going through a taping technique typically used for jumper's knee patellar tendinopathy that uses kinesiology tape or K-tape. We've got my assistant here.
Hi, I'm Rawal Graham Bell, small forward for the Bristol Flyers.
Cool. So obviously you want to make sure skin's clean before you do any of this. With the K-tape, what we tend to do is sort of round the edges off to make sure that if there's any shorts or any other sort of fabric that can get attached to it, it doesn't. So we round the edges off to make sure that that doesn't happen. So we'll start off with legs straight in this position. Again, we want anchors top and bottom. So the anchor you want to aim for the sort of knobbly bit at the top of the shin bone, the tibial tuberosity. So right over that sort of area. You could use, or it's recommended to use, adhesive spray before doing this to make sure that the tape sticks to the skin. So we got that one on the top, and then you want to go a few inches sort of above the patella, above the kneecap, just where the other anchor. Again, adding a bit of tension to it. On there. Does that feel all right, Ro?
Mm-hmm. Yeah.
Beautiful. So we're going to go. This is mainly trying to offload that tendon that sits underneath the patella. So we're going to go one sort of a semicircle motion sort of around the outside, inside, and then another one around the outside as well. So as I do this row, you're going to slide your heel towards your bum to add a bit of tension to the tape, all right? So we're going to start off on that anchor. And then don't worry if it goes above the top anchor a little bit. So if you start sliding your heel, Ro, and then as Ro slides his heel, going to add a bit of tension to it, like that. Feel all right? Fantastic. Again, try to keep the creases out of it, but don't worry if there are a couple in there. And then slide back down. You want to make sure that the patella's got free roam as well, so make sure there's no tape going straight over that kneecap. And then exactly the same on the outside. So again, using this anchor at the bottom. And then as I start coming around, Ro, you begin to slide that heel. There we go, fantastic. Cool. Then make sure once you've done it, you're making sure it's all stuck to the skin. Like I said, spray would help with this. It makes it quite a job to get off, but it makes it more effective essentially because it's able to stick to the skin slightly better. Slide back down for us, Ro. So that's the sort of pattern you're looking for. Again, don't worry if it looks slightly different. There's many different techniques you can use, but this is the one that I typically use. Feel all right sliding back down? Fantastic. Yeah, so again, that's typically for jumper's knee, patellar tendinopathy, any sort of chronic knee condition like that. A lot of basketballers use it, and I think it's quite effective amongst them. So.